myself dietitian Rajeshwari. I am working as an assistant dietitian in UN Institute of Cardiology and Research Center. Today I am going to present addressing the double burden of obesity and NCDs. Today we are start the presentation on topic of outlines. What is obesity? Causes of obesity, health conscious of obesity, obesity and diabetes, obesity and cardiovascular disease, obesity and chronic respiratory disease, obesity and cancer, obesity and mental illness, barriers to prevention, recommendation and conclusion. First, what is obesity? Obesity is a one kind of medical condition जहाँ पे बॉडी में एक्सेस परसेंटेज में फैट जमा होता है. What happen when excess परसेंटेज में फैट जब बॉडी में जमा होता है, because of excess percent of fat, body gets so many increased health problems like cardiovascular disease, kidney disease, and diabetic and so many others disease. हाउ टू मेज़र ओबेसिटी. अब ओबेसिटी को मेज़र कैसे करेंगे? ओबेसिटी को मेज़र करने का सेम टूल है कि बीएमआई. बीएमआई को यूज़ करके हम आसानी से पर्सन ओबेस है, ओवरवेट है या उससे भी ऊपर का में कंडीशन में आता है तो वो हम बीएमआई से उसको मेजरिंग कर सकते हैं. इन चिल्ड्रन, हाउ टू मेजर ओबेसिटी? ओबेसिटी मेजरिंग चिल्ड्रन इन we are not taking BMI less than 5 years age of children. उसमें हम क्या करते हैं कि हाइट, अकॉर्डिंग टू हाइट, चिल्ड्रन की हाइट से वेट उसका ज़्यादा है टू स्टैंडर्ड मेजरिंग, तो उस हिसाब से हमें पता चलता है कि 5 ईयर्स से कम के बच्चों में ओबेसिटी है. फॉर चिल्ड्रन 5 to 13 years या 19 years of, we can use the BMI to measuring the obesity or overweight children or not. Types of obesity. Two types of obesity. In obesity, central obesity, also called as abdominal or upper body fat, more common in a man. Fat stored around the organs of the abdominal increase the risk of some disease, diabetes, high cholesterol level, high blood pressure and heart attack disease like etc. Lower body fat, फैट अराउंड द हिप्स, बुटॉक्स एंड थिक्स. ये लोअर बॉडी ओबेसिटी में क्या होता है कि पूरा फैट जो है वो मतलब हिप्स के साइड पे, थाइस के साइड्स पे जमा होता है और उसकी वजह से पूरा बॉडी शेप हमारा मतलब खराब लगता है. मोर कॉमन इन अ वुमन. ये वाला जो ओबेसिटी का जो पार्ट है वो जनरली हम वुमन में ज़्यादा देखते हैं. कोजेस ऑफ ओबेसिटी. ओबेसिटी होने के क्या कारण है? फर्स्ट तो एक है कि हमारा बिहेवियर और लाइफस्टाइल, दूसरा है डिजीज, तीसरा है ड्रग, चौथा है जीनेटिक. और उसमें फर्स्ट वाला बिहेवियर फैक्टर्स, उसमें क्या आता है? व्हाट इज अ बिहेवियर? बिहेवियर फैक्टर में आता है अनहेल्दी डाइटरी पैटर्न्स, लेस फिजिकल इनएक्टिविटी, मेडिकेशन यूजेस, इजी अवेलेबिलिटी ऑफ फूड, unfavorable physical activity and environment, less education and skill, food and marketing and promotion. These are the all are behavior factor. First, अनहेल्दी डाइटरी पैटर्न्स, उसमें क्या आता है कि हम जो भी पूरा लाइफस्टाइल जो हमारा रहता है उसमें हमारा एक पूरा कोई हेल्दी पैटर्न नहीं होता है. जो भी हमें जिस टाइम पे जो खाना मिलता है हम वो खाना खा लेते हैं, जिसमें ज़्यादातर फैटी फूड्स होते हैं या फास्ट फूड होते हैं जिसकी वजह से ओबेसिटी मतलब हमें हो सकता है. दूसरा है ड्रग्स एंड डिजीज़. तो ड्रग्स एंड डिजीज़ की वजह से ओबेसिटी मतलब कैसे हो सकता है? तो सम ड्रग्स हम यूज़ करते हैं, जैसे थायराइड का जो ड्रग है उसकी वजह से हमारा वेट गेन होता है. दूसरा है स्टीरॉयड. हम जितना स्टीरॉयड लेते हैं तो स्टीरॉयड की वजह से भी हमारा वेट ज़्यादा गेन रहता है. और दूसरा है पॉलिसिस्टिक ओवरी सिंड्रोम यानी पीसीओडी और पीसीओएस. ये दोनों सिंड्रोम जो होता है उसकी वजह से भी हमारा वेट गेन होता है, जो हम उसको हम मतलब वो कैटेगरी में रख सकते हैं कि ड्रग्स एंड डिजीज़. दूसरा फैक्टर है मेंटल इलनेस एंड जीनेटिक. मतलब कि अगर आप मेंटली डिस्टर्ब हो, मेंटली डिस्टर्ब की वजह से अभी ज़्यादातर ये हो रहा है कि लोग अकेले रह रहे, अकेले अकेले वर्कलोड उतना है जिसकी वजह से वो लोग मतलब मेंटली इतने डिस्टर्ब हो गए हैं कि उनको पता ही नहीं है वो क्या मतलब कौन सा लाइफ जी रहे, क्या खा रहे, क्या पी रहे, कहाँ जा रहे। ज़्यादातर लोग मतलब इतनी लाइफस्टाइल चेंजेस की वजह से वो लोग में डिप्रेशन भी आ गया है। ईटिंग डिसऑर्डर्स जिसको बोलते हैं, उनको जब मन आए जो किया, जहाँ मतलब जो खाना मिला वो लोग खा लेते। जैसे सबसे ज़्यादा फास्ट फूड की वजह से ईटिंग डिसऑर्डर सबसे ज़्यादा मतलब वो लोग ज़्यादा फास्ट फूड खाते हैं जिसको बोलते हैं ईटिंग डिसऑर्डर्स। और दूसरा है एक जीनेटिक ओबेसिटी में, ये भी फैक्टर बहुत मायने करता है कि अगर आप पहले से ही आपकी मतलब फैमिली में कोई पहले से ही अगर ओबेज है तो वो जीनेटिकली वही साइकिल चला रहा है जिसमें पर्सन टू पर्सन ओबेसिटी रोल करता है। Health consists of obesity. According to CDC, obesity affects almost all organ of systems and creates adverse health effects. Hypertension, type 2 diabetes, coronary heart disease, stroke, gallbladder disease, arthritis, low quality of life, mental illness, chronic pain, and so many other consequences. Obesity and diabetes both are the connected disease. Diabetes mellitus and obesity have a complex relationship. Obesity stands out of a risk of factor type 2 diabetes. Obesity causes insulin resistance and it become a precursor of type 2 diabetes. Genetic predispositions, environmental factors, and sedentary lifestyle is the causes of obesity. Because of obesity, impaired glucose tolerance, beta cells failure, and this is the reason of type 2 diabetes. Obesity and diabetes. In the Harvard Alumni Health Study, it was found that body weight and high blood sugar level are directly released, and weight gain is a significant risk factor for the development of diabetes mellitus. Person with central obesity are more at risk of developing a diabetes and cardiovascular disease. In 2001, NIH Clinical Research Unit Arizona conducted an experimental study to find out that adults with a waist to hip ratio greater than 35.5 in a male and 38.5 in a female had impaired glucose tolerance and hyperinsulinemia. But having a weight reducing diet and physical exercise for the 6 month it become a normal. According to Health Technology Assessment Systematic Reviews 2008, for each kilogram of weight gain annually over a period of 10 years, there is a associated of 49% increase in the risk of developing type 2 diabetes in the subcutaneous subsequent 10 years. According to WHO reports 2030, 86% of adults with type 2 diabetes are overweight or obese. A comparatively study conducted by a BIDAS in January 2011 to December found a significant association between diabetes mellitus and obesity in this. Their women are found more obese than a man and more prone to developing diabetes mellitus. Also, younger people are more risk than older people. Obesity and cardiovascular disease. Obesity increase the risk of the developing of the cardiovascular event. Three mechanisms are the responsible for the obesity related hypertension and as the consequence the cardiovascular disease. Activation of the systematic nervous system, activation of the renin and angiotensin system, sodium resistance. The consequences of the both obesity and obesity related hypertension leads are the cardiovascular disease like stroke and myocardial infection. Obesity is related with raised lipids, which in turn causes atherosclerosis, followed by development of cardiovascular disease. In Framingham heart study, it was found that a 5% weight gain was associated with a 20 to 30% increase in a hypertension and isomenic heart disease incidence. Harvard Males Alumni study found a weight gain of 25 pounds was associated with a 60% of increase in hypertension and cardiovascular incidence. Study of 2008 across different ethnic groups like Chinese, Japanese, Maoris, it was found that obese women were at twofold risk of developing CVD in BMI group of 24.0 to 24.9 kg per meter square. WHO recommended the use of the lower BMI cut points of the Asian population. According to WHO STEPS survey, Bangladesh in 2010, the prevalence of hypertension is 17.9 in general, 18.5 in men, and 70.3 in women. A health survey as the year 2015 on 665 students of the Rajshahi University aged 22 to 25 years reported that major portion of the obese. Obesity is associated with chronic inflammatory state, and adipose tissue also release some inflammatory mediators and causes many respiratory disease like obstructive sleep apnea, obesity hyperventilation syndrome, COPD, obesity related asthma. This slide shows us to how to reason obesity because of respiratory disease. Obesity, one of the first reports of identifying an association between symptoms of asthma and overweight was the published in 1984. In this uh, representative study held among British population, the relationship between overweight and 7 respiratory symptoms was found. A cross-sectional study in the Santos University Hospital, Brazil. It was a reported adolescents with BMI greater than 30 kg per meter height per meter square have a significant decrease in lung volume and total lung capacity. The prevalence of lung disease in the obese people found to be a high in the different over studies, obstructive lung disease having a predominated. Obese people often have a chronic low levels inflammations which can over time causes DNA damage that leads to the cancer. A study in 2013, Australia among the post menopausal women, obese and overweight women were found to be into to about found two or about 4 times risk than normal weight risk than normal weight women to develop endometrial cancer. World Cancer World Cancer Research Foundation reports 2015 reported that obese people are silently about the 30% more than likely development colorectal the cancer and the normal weight people. This study also reported that post-menopausal women with higher BMI are the modest increase the risk of breast cancer. Obesity and mental illness are the interlinked due to psychiatric illness. Depression is the lack of physical work, poor body image, binge eating, and anti-psychotic medication causes obesity. Again, the social situation created by the obesity may also leads to mental illness. How to connect obesity and mental illness? This slide, because of so many reasons show in this slide. In a longitudinal study in 1997, among US adolescents, increased BMI was positively found to be related to depression. In US Healthy Survey 2011, it was found that 15% of the obese men were taking antidepressant. About the same among the had some type of sleeping problems. In 2014, four different national studies across the Europe and Australia shows that 46% to 79% of seriously mentally ill individuals have BMI greater than 30 kg per meter square. In 2030, researchers from the Monash University reported that obese children show signs of the emotional disturbance 23.4%, then non-obese children are 14.3%. Barriers to prevention for adults. Some people may not choose to change their lifestyle or agree to the treatment. Lack of knowledge about buying and cooking food and how diet and exercise affect the health, to the cost and availability of the foods and opportunity to the exercise. Safety concerns, for examples about cycling, lack of timing, personal tastes, the views of family and community members, low levels of the fitness and disabilities, low self esteem and lack of assertiveness. For children and young adults, availability of junk food nearby the schools, lack of time, lack of confidence and low self-esteem, secretary of playground in school and residential area. These are the so many barriers to the reason of the obesity. Prevention. How to prevent the obesity? Two types of prevention approach can be taken to prevent the control obesity. First is population based approach. Population based approach, and second is individual based approach. This slide shows us population based approach and approach to obesity and preventions. Individual based approach, providing information and lifestyle modification. This part includes providing information about healthy diet and physical activity, aware the person about the consequences of the excessive weight gain, adjust the portion size to age, gender, weight and active level, encourage children to eat regular meals including breakfast, encourage the intake of low salt foods, limits the intake of energy dense foods and the fast food, encourage intake of the daily 5 ratio of the fruits. These are the dietary advice to the obese patient. Physical activity for the children. Encourage children gradually to the perform at least 60 minutes of moderate to vigorous exercise daily. Discourage sedentary behavior of more than 2 hours for the children, particularly screen time. Encourage family approach to physical exercise. Encourage adults to do at least 30 minutes of moderate intensity physical activity or 5 more day a week. This should be a build up over time. Start by walking 10 minutes a day a few days during the first couple of week. The add more the time and days gradually. This part managing obesity. This part is the approaches for the those who are the already suffering from obesity. It includes taking history and identifying the risk factor, taking appropriated measurement, giving proper dietary advice, advising proper physical activities, psychological assessments. In a conclusion, obesity epidemic a new challenge in a public health professional, as it is one of the main risk factors for the most of the non-communicable disease. National and community level, well well as individual level approaches are needed to take to face this challenge. Thank you.